Thank you to all of you. So I've got a couple of questions here. The first one for Mark specifically, and as we talk about consumers, but you mentioned sometimes producers, we get divided in this business and we are not kind of joined in making a common progress and what have you. How do you deal with that with your customers specifically, and when you hear them, they don't want to learn, they're kind of griping, what have you? Yeah.
Producers gripe. I couldn't believe that would ever happen. Yeah, I'm shocked. It's communication. I've taken a lot of criticism for engaging with the World Wildlife Fund, and they actually came and spent a day with us on our operation, watched us process cattle, and I think it's the interaction that we have. And I mean, when we sat down and we're visiting, they go, well, "What are you afraid of?" And I'm like, you know, you're this tree hugger that wants to put beef out of business. And I said it with a smile, but I'm speaking as Billy Bubba producer also. And so then when you find out how professional they are and how they want to go to the ecosystems that are not, and if it's good for wildlife, guess who makes it better? The beef industry and the ranchers that do that. And so to answer your question, Neville, it's just that transparency and that communication and actually bringing those people in to talk to our customers. And you know, it's no different than you or me. I mean, my God, you're Dr. Neville Spear. Well, I know you as Neville, and you're a good guy, and we can talk about it, we can disagree, and then we can get to a better place. So I think oftentimes it's back to Henry's deal with the windmill. We can't fix it because we're too busy. Well, in agriculture, and especially the independent cattlemen, we're often secluded, and we get lonely in our thoughts, and we get off in our thoughts, and so we have to have that communication and collaboration.
I've got one other question. I think this is for you, Paul, specifically. How will funding increase? How will funding increases for the AMR Center occur, and what can we do to help besides maybe a GoFundMe? Right?
I was going to say, yeah, money. So certainly we're working hard to start thinking about that funding mechanism and going and making sure, assuring ourselves that we're sustainable, and we're looking at a diversified portfolio, if you will. So part of the stakeholder engagement is likely to be an engagement where members and entities that want to participate would have, hopefully not a big one, but a financial buy-in. And we think we need that, number one, for sustainability, but we also need that because we believe that people that have a vested interest in the success need to have a stake in it. And a lot of these groups, it's easy to say, oh yeah, we're part of that, but if you don't have financial investment in it, then sometimes you don't have the stake to make sure that it's successful, and you're not as likely to participate in those types of things. So certainly a portion of it will be through membership type process, and that's where a lot of that stakeholder engagement is going to say which of these models make sense. How do we structure that membership buy-in type of scenario to make that a win-win for you as a stakeholder buying in, but for the Institute in terms of sustainability. That said, we also are very focused on some other streams, and so certainly some of those could involve philanthropic avenues, and there's quite a bit of money coming out of various organizations going into antimicrobial resistance already, and so garnering interest and showing our niche and our ability to bring commodity groups and stakeholders on the ag side together, which right now has not really been successful in a lot of other groups. And so being able to demonstrate that, we believe will give us some potential interest and buy-in from philanthropic groups. And then finally, through advocating for appropriations that would help to support this kind of multidisciplinary, multi-institutional, really all aspects, commodity groups, industry, and producers and veterinarians together. So much of our governance, our initial governance structure is modeled off of a group called the Antimicrobial Resistance Leadership Group, the ARLG. Dr. Patel on our executive advisory panel is part of that group, and that's an NIH funded group focused entirely on human medicine that was initially funded at, I believe, close to $50 million for 4 or 5 years, and now NIH is reissuing that at, I believe, $70 million for the next 4 or 5 years. And so we're certainly starting the grassroots efforts to advocate that multiple federal funding agencies that could potentially go together and develop a multi-agency funding mechanism to support this type of approach. We believe is needed and hopefully can be achieved.
I want to draw your attention to slide O while we're answering questions here, and please respond. Go ahead. Thank you.
So this question and comment is for you, Paul. Cheryl Stroud, One Health Commission. You said you weren't quite sure how to bring the College of Design in. Mm-hmm. Don't you need infographics and all these communication materials? I mean, this is a One Health effort here, so just a little...
Yeah, so that's a good point. When I made that comment, I probably should have mentioned that now, since we've been selected, the College of Design is involved, and they made my pretty PowerPoint slides for me, and so we definitely have got them involved early on as a consortium. A lot of our early efforts were more on the research side, but now as we look at those outreach efforts, communications is huge, right? And so College of Journalism and all of those groups are involved. So now we do have them involved. We didn't at the early stages.
One more question.
I'm going to get the final word. My name is Andy McCabe. I'm the CEO of the Association of American Veterinary Medical Colleges that Paul mentioned in his talk. And I just want to say that before we conceived of this institute, we were very well aware that there was extensive research being done in this area, both by, within academia, across the country and around the world, in industry, the animal health industry and the commodity groups. And one pathway forward was just to continue along that road. And we would, have individual researchers here and there working on these areas. But what we saw was the opportunity to consolidate that and get some synergy out of it. And Mark, it goes to what you said, it's about relationships, right? Mm-hmm. It's about building teams and partnerships and getting connections that we weren't even aware that existed. The adage that, we don't know what we don't know that we heard earlier. And to your point, Cheryl, the idea that it was not obvious at the beginning exactly how the College of Design might fit into it. As the Institute is selected and as they move forward, it will become increasingly apparent, including with ideas about engineering, design thinking, and social sciences, and all of those added into this. So it's really a remarkable opportunity to put into practice a One Health approach that you mentioned so eloquently in your talk, and Dawn, I know CDC has done a lot of work in this area. So we hold out great hope, no pressure, Paul, but we're expecting all the answers probably after the next 9 months. Right?
Yeah, that's right.